Let's get started. Many of you, I'm sure, have been at one of these webinars with us before. I would love in the chat, again, just if you just say this is your first time, you've been to multiple webinars. We would love to gauge the audience and know who we're speaking to, so we know the right level of depth and background that we can share to not waste anyone's time, but to make sure everyone's up to speed. So we've got over 40 people right now. I would love to see 40 messages in there from everyone, where you're at, and that'll help us determine where to go with today's webinar. Second call, this is the first time for Rosemarie. Thank you. Would love to know how everyone else is doing. First time, lots of first time people here. That's awesome. Many times, fantastic. Being a bunch of these, great, Marco. Hopefully this one's going to be valuable to you because we've got some pretty incredible announcements, and we've got a very special guest who's never been to one of these before, which is Arthur. So Arthur is our CTO. He was the former lead architect for the Apple Vision Pro. He's now leading our technology development and engineering. Arthur, I'd love for you to just introduce yourself to everyone here, and we'll go from there.
Yeah, great. Thanks for the intro, Joseph. Hi, everybody. For those who don't know me, I'm Arthur. I am currently the CTO at Innovega. And as Joseph was saying, I spent many years at Apple. Was very fortunate to be a part of the Apple Vision Pro program from the beginning to the end. And learned a lot. I think we produced an amazing product. And after doing that, Steve called me up and said, we're doing amazing things at Innovega. Really wanted to be able to help with that mission here of helping the people with low vision and who are legally blind. And so got me able to join Innovega, and I'm very honored to be here.
Amazing. And I think most of you know Steve. Steve, feel free to introduce yourself.
Sure. I'm a co-founder of Innovega. I'm the CEO, and I have been on these webinars a few times. So thank you, everyone, for many of you are shareholders, and we appreciate that so much. But thank you for your time today. Arthur is modest. He's brilliant. We're very fortunate, and we're the ones that are privileged to have him on board. But he's such a big addition to the team. And what he didn't add is when he came to us from Apple, he said something to me that really resonated. He was excited that we had such a purposeful mission, and we share that with amongst everyone at Innovega. But he said this smart glasses thing is going to happen. We're at a precipice now. We've gone from kind of concepts to critical mass. It's going to happen. And Innovega has always been on the forefront. And as he looked over the landscape, we had the cutting edge research, and we had the really a cutting edge solutions that can go to market, enabling us to take leadership. And I think that combination of we've picked a community that we can help quickly and significantly, and we can offer technology that is so unique, is the basis of a company that certainly I want to work with. And Arthur and I share that as kindred spirits. As you get to know more within Innovega, and of course we have Joseph on the call today, steering the call. You'll realize that we all have that same belief, and we're excited, and we're moving very quickly. So again, thank you for attending today. Those of you who are shareholders, much appreciated. And those of you who are kind of looking for a reason to join us, hopefully we give you that on this webinar today.
Thank you, Steve. Appreciate that. And just so everyone knows, this is being recorded, so we will share the full replay afterwards if you're not able to stay the whole time. And we will open it up for all kinds of questions at the end as well. We'll try to be about 20 minutes or so before the question period. So Arthur, everyone keeps asking us about new prototypes this, new prototypes that. Help us provide clarity on what did we do at CES? What were these prototypes that we showed? And tell us all about what they mean and how they function.
Sure. Maybe stepping a little bit back, you've probably seen all the content that Joseph has been putting on all the different platforms out there. where we've been doing a lot of demos with low vision patients, with people who are legally blind. And that kind of level of prototype is something that we've hand built, right? We've taken components that were off the shelf. We've done our own little engineering in our lab, in our facility. And we put together something that is kind of cobbled together from different pieces. And we've been using that with the demos that we've been doing in our San Diego facility. Um, Even with that kind of a level of prototype, we've been seeing amazing results. And that gives us a lot of confidence to move forward to say that, yeah, we actually really have a good solution with the technologies that we've chosen, with the architecture that we've chosen, that we can really help this community of people. With that confidence, we've been working with an engineering design firm to actually integrate all of those components into something that really looks like glasses. We've heard a lot from the community that, aesthetics, how the glasses look on by wearing them, is very important to this community, right? Even though they're low vision, they still care about how they are presented to the public. And so we've been working very hard with this engineering design company to come up with an industrial design, an ID that really looks like glasses when being worn. And at CES was the first time we actually got that physical mock-up, what we call a buck. And that is something that is ID representative, industrial design representative. So it looks like the glasses that we are going to make, and is about the same kind of weight, the same kind of form factor that we would actually be producing as a pair of glasses. With this kind of a physical prototype or a buck, the purpose really is to actually hold it, touch it, look at it, see it from all angles. Is this really the right design? Does it look amazing? Try it on different people's faces and see how it fits. Look at the weight, the comfort, the balance of it. Does it fit all people of different face types? And so with that physical prototype that we got at CES, we were able to do a lot of that testing. And so, for instance, I have one here. Steve probably has one on his desk as well. And we were able to really validate that, yeah, this is an amazing design, that we can actually put all of those electronics into something that looks really amazing. And I've also spent many hours just wearing the prototype, walking around, just doing my everyday thing, just wearing the glasses, just to gauge, is this the right level of weight? Is this the right kind of comfort and balance? And that's what we were able to do with the prototypes that we just got right before CES.
Amazing. So tell us about CES. What were you hearing from visitors, attendees, press and media members, and what did you see in terms of, what's hot right now in terms of new up and coming technology? Give us, I'm sitting here right at the CES floor. This was taken, from our booth. Bring us into that and just help us understand, what's happening in this industry right now.
Yeah, so Steve and I have gone to CES many, many times throughout the decades, right? And so it's fairly normal for us to see a lot of excellent technology as technology advances, and having a ton of people be able to showcase that. For us, really, we wanted to do a couple of things. One was to get some more visibility into Innovega and understand what kind of technologies are out there in that space. And then the second really is to further our development with our supply chain vendors that were all coming to CES as well. And we can talk about that in a little bit. But looking at kind of CES in general, right, it really is a conference to showcase a bunch of technologies. We continue to see AR, VR glasses, smart glasses as a big part of that show. But I think the majority of the time when we go to CES, we actually see a lot of technology that is looking for a problem to solve, right? There's a lot of cool advanced tech out there, but there really isn't that focused application of, well, we really want to tackle this problem that consumers have. And we saw that again this year, even at the Showstoppers event that we were at, where we had a booth for a few hours. There were other smart glasses companies out there, and the people coming by were like, "Oh, you are another one of those smart glasses companies." And we had to actually step back a little bit and say, we are a smart glasses company, but we have a problem that we're trying to solve, right? And so we're starting with the problem and finding the right technologies, the right architectures, the right design to actually solve that problem, rather than just putting a bunch of really cool tech together and then hoping consumers will figure out what to do with it.
Makes sense to me. And you were the one who first broke that down to me is because I walked around and I saw probably five or six other smart glasses booths. But the one thing that stood out to me is nothing is really differentiated from one another. And you nailed it on the head is there's this technology that's burgeoning, but people haven't focused on a use case. And that's one of the best things that we had heard from media is that we're hyper focused on a huge target market and solving a specific problem. Steve or Arthur, you talked to a lot of media members when you were there. Any highlights from you? And what was the feedback from the global press when they encounter our booth?
I got a couple. I'll just share a couple of questions, and I'll let Arthur jump back in. But the writers and journalists, there were like 900 in the event that you're describing, Joseph, where we were, and they filed by our booth with great excitement about what's new. We're so-called frontier technologies, and two questions stood out to me. One fellow came over and sort of pushed me into the corner and said, "Is this another toy?" And I said, nope. And then about a half hour later, someone came up, and I swear he pushed me in the same corner. And he said, "Is this another smartphone on your face?" And I said, nope. And I realized that the media, these writers were preconditioned, like, oh, here we go again. It's like another fun thing, and we're going to be using it as a doorstop in a week. And I had to explain to them that the interface of smart glasses was fundamentally important. And our company was established believing that this was inevitable and we were going to play an important role. And it really took time for the industry to catch on. I mean, smartphones, everyone carries them. Smartwatches, some of us wear them. But smart glasses are very difficult. And I think Arthur understates the complexity of getting something this powerful in a pair of glasses that you're willing to wear all day, comfortable. So we had a great event from the standpoint that once they realized that we're not a smartphone on someone's face, and we're not a toy, they lingered at our booth. And one of the conversations I had with our colleagues was that we're not moving people through our booth fast enough. The average rider was spending 20 minutes, 15, 20 minutes instead of taking 3 minutes and filing on to the next booth, because I think there was like 30, 40 booths or maybe more. So I took a lot of, I felt very good about that event and the feedback that we received. A handful of them telling us that they will write about us because we were the highlight for them of CES. We actually had technology that was absolutely novel from a standpoint of performance, that fit and performance combination. But also the fact that we had testimonials and we had an individual in our booth who's legally blind. Isaac Jean-Paul is a person who's been at our labs and wore glasses that Arthur was describing, our demonstration glasses, and he saw the immediate benefit. And he was willing to travel to our booth and stand with us and talk to writers about the impact that these glasses are going to have on him and 300 million like him who really require a better way to see their world. So anyway, that whole piece of it, the media component was one of the reasons why we went to CES. We have no PR. We've been very quiet, lying in the weeds, waiting for smart glasses to happen as an industry so that we then could position ourselves in that industry as we have and as we achieved at CES.
Smart glasses is definitely an industry. I found that it was the focus of the entire event. And actually, a couple early press articles have already come out. I've put those in the chat if anyone's looking to read them that
Right.
do feature Innovega. And just some of you have seen a little bit about how the glasses work, but I would like to just share a 90-second video. For those of you that are new, I knew a lot of you are new to this webinar, and I just wanted you to walk through basically the functionality of how these work.
Feel like
So
lightweight everyday
let me turn the volume down. So, basically, as we said, it's a regular form factor glasses, and there is a ton of tech in these, which makes it so difficult to get them this small. We've got a center mounted camera in the middle that captures the world in front of you. It connects to your smartphone with an extra battery pack. And once you're powered up, there's the digital projection displays that are pretty magical when you put the glasses on. And what they do is they show you what the camera sees. It's a kind of an HD TV floating in front of your face, if you will. And what you can do is you can look at the screen while also looking at the world around you. You can look through the screen if you choose to. And that screen is what's showing a digital projection of the real world. And you can zoom and you can change brightness and you can change clarity of the screen to make it fit your vision needs. So it's like a real-time customizable digital prescription, if you will. You don't disappear from reality like in most VR headsets. You stay within it, and the whole point of the glasses is to help people engage more fully with life. Out in the real world, we're really hoping to bring the low vision community, which is massive, to engage with life to the fullest capacity. And tools like this, we fully believe, are going to be a game changer in how technology helps us interact more in the future, rather than into this technology isolation where a lot of other technologies are leaving. So we're really excited to continue to share this, continue on down this path. And Steve, I know another big part of the CES event was meeting with some of your global partners there. Do you or Arthur feel like telling us about some of those meetings? I know you can't probably disclose everything, but we'd love to hear whatever you're willing to share.
Yeah, it was a second purpose of the of CES. Maybe there was a handful of purposes total, but one was to gain the exposure that we deserve. The second, it's a wonderful meeting place for supply chain participants. For those of you who don't know CES, there's 150,000 that show up every year, and you get to know the folks and you get to know who you want to work with. And that's what Arthur and I have been focused on, picking the entire end-to-end team that will take our product from demonstration to commercial solution. And there were about 4,000 vendors at this event. So this is the greatest show on earth. And we were there and we were significant. But Arthur, you're absolutely the person to talk about the process from where we stand today through, I'll call it Apple quality, Meta, Apple, Microsoft quality device that will be our commercial eyewear that we take to market. And then with that backdrop, perhaps you can talk at a high level about the folks that we met with and the confidence that you have and I have that we have the right supply chain to take this to market in the right fashion. So if you want to,
Yeah, I would love to actually address an earlier point a little bit, just from all the folks that came by our booth,
yeah.
and how that actually is different from any of the other smart glasses. I think we get that question quite often is, well, there's a million devices out there. Why can't we just buy one of those and apply that to low vision? And at the end of the day, we need to purposely design, purposely build a pair of glasses for an application. And if you don't do that, then you end up having something that just isn't optimized for it, right? Doesn't quite work. And so doesn't have the right features that really help that community of people. Uh, there are, for instance, entertainment glasses out there. Those that have big screens are made to just watch videos. And those are okay, but they don't necessarily have cameras on them, because if it's an entertainment pair of glasses, you don't need that camera stream, right? Or they don't necessarily sit on your face, right? And if you're on your couch or you're on the plane or on the bus watching those kinds of things, that's not necessarily the most important part of it. And so, those entertainment glasses don't fulfill that kind of application. Then there's those kind of social media types of glasses, right? Those that have the camera on the side, may or may not have a display. And those kinds of glasses are great for live streaming things or posting on social media. But they're not designed to have something be presented to the person all the time. It's not designed to have the camera running all the time. And so those glasses, even though they look really great, aren't really good for people who have low vision. And then there is those now starting to have these display glasses that really are meant as informational displays, right? You see things like live translation or a text message pop up or very kind of lightweight navigation, those types of things. And that's kind of actually bleeding edge technology in terms of what we can do with smart glasses. But those are also not great for low vision folks either, because they have a small field of view, or they're only one color, or their resolution is really low. And so these glasses are not being purpose built for an application or for our application. And that's where we really find that, if we really wanted to help people with low vision, we really needed to build a dedicated pair of glasses from the ground up to be able to support that. And with that kind of architecture, that kind of leads us to where Steve was going at. We were meeting with our entire supply chain to be able to build that pair of glasses from the ground up. We have a design, we have the physical prototype here already with all the component placements that we believe we need for the glasses. And we're in the middle of actually doing our first proto build. And that proto build means it's a fully integrated, but not yet consumer ready pair of glasses, not fully tested, not drop tested and reliability tested, and passes all the certifications that we need to be able to sell it. But this is the first time we're integrating all of that deep tech into a pair of glasses that look and feel great. We were meeting with our vendor that was doing that design and making sure that we have all the pieces in place to be able to have that design. And we're targeting to have that in the next couple of months. We were also meeting with our supply chain to take that design to market. And there's a ton of work to be able to build a pair of glasses that have that quality in terms of, everything is sealed correctly, everything is reliable, being able to pass all the certifications that we need, and be able to actually get it into the hands of consumers and have them be able to wear it and live with it without fear of it just breaking on day two. And there is a very standard kind of process and hardware for us to be able to build glasses from kind of that early stage of I have an idea, I have a design, all the way to something that is consumer ready. And we call that three different kinds of builds. We call that EVT, DVT, and PVT. And that is what we're going to be focusing on with our contract manufacturer for the rest of this year. We also met with one of our key suppliers, one of our display suppliers, that is going to be putting some components into our product. And that is also a critical part of our supply chain, being able to have access to all the different technologies that we need to be able to design or build that pair of glasses.
Amazing. And so, we're starting to come up on 25 minutes. I know everyone's busy. So I just want to say, for those of you who have been around Innovega for a while, it's always been about the development of the technology. And I think it's refreshing for everyone to hear so much focus on the production and the manufacturing readiness or preparations, and really how Innovega is now finally transferring into a new phase of its journey, if that's a fair thing to say, Arthur. And on that note, we'll do questions in a second, but Innovega has been working very, very hard over the past several months. And the fruits of those labors are that we are now, this is the first group that's going to be privy to this information. We are now opening up pre-orders for the prototypes themselves. So we are officially going into the first phase of our monetization strategies, which is hardware sales. There's a link in the chat, which is to a series called the Founder Series, which is our very first release of the prototypes that will look quite a bit like the ones right behind Arthur's face. And now is the first chance that anyone can go on and purchase them. There's a lot of special perks to be included in the Founders community. One is that there's an estimated savings of $1,000 off the hardware itself. We bring you in, you're an early user. We want your feedback. You get the best possible support from our team because we want to learn from you as we continue to move this through the world. So I strongly encourage everyone to go check out the link that was just shared in the chat. And now we're going to open it up for questions across the board, unless there's anything, Steve or Arthur, you wanted to add before we move forwards. And we look forwards to full transparency with everyone and meeting you where you're at. I also want to add that if you don't have a chance to ask all the questions right now, you're more than welcome to schedule a call with our VP of Strategic Growth and Partnerships, Corinalyn. I've also included her link in the chat, so you can click right there and book a quick call with her if you want to have additional support after this webinar. So with that, if anyone has any questions, please leave them in the chat, and we'll keep it moving.
I do want to mention, though, that the pre-sales that we're just launching now, they are for our very first units that are consumer ready, right? Not the prototypes. So these will be fully tested, fully certified units that will go out. But by doing the pre-sale now, you kind of join that founder community in the sense that, we'll keep you in the loop. We'll be able to do early testing with you of the prototype devices. And so you get early access, but the product that you are purchasing is that consumer ready, fully tested, fully certified product.
Yeah,
Dino,
and
go for it, Steve.
Jeff, I was going to say, I'll add to that. I think all of us have been disappointed that we've been involved in a pre-order, and then at the time of delivery, we've been told out of stock or it's another 3 months. And I'm not picking on Meta, but I know I've got friends who are looking to buy the Meta glasses. Hey, Meta's done something, let's give it a go. And they're being told that they need to wait another 3 months. In this particular case, we're offering a serial number against the purchase or pre-purchase of these glasses. So you join our community. We're going to be very active working with you, sharing all we have and all we know on prototypes. We're thinking through some programs, but at the end of the day, you will be the first to get the serialized. If you're serial number 10, you will get the 10th pair of glasses off the assembly line before anyone else. And I just know how important that is. And particularly, and how important it is to those who are not watching TV or not going to a ball game and enjoying all the things they have. So it's an important element that A, it's a community, we're all in this together, and B, we're guaranteeing you access to glasses as early as we possibly can. Consumer grade, smartphone grade glasses. Thank you.
All right, Dino, I'm going to go back to your great question, which was, what effect will long-term usage be for the eyes? It's been said that long-term close-range focus on our phones is causing additional damage. He understands that we can see through these glasses, but the eye focus distance is still less than a half inch from the screen. Care to address that, Arthur or Steve?
Yeah, absolutely.
Great
So with a lot of these glasses, either when you talk about AR or VR, the physical screen, the actual panel or the display is actually very close to our eyes. And absolutely that means that, there is some light source that is built into the glasses that is physically close to the eyes. But through all the technology that's part of the display, we actually create a virtual image, the image that your eye sees, that it's much further away. So it's not actually, half an inch from your eyes, but what you actually see is an image floating in space that is about a meter away or a meter and a half away. And that allows the eye to be able to both converge. So as your eyes, look at objects, they kind of align both eyes to that object and also focus your eye onto that object. And it's all being focused at the meter or a meter and a half away. So in terms of the long-term comfort or the effects of the eye, it is like looking at something that is much further away than the displays actually on the glasses.
Steve, anything you wanted to add to that?
No, I think that's really important. Humans have evolved a certain way. When we don't see things half an inch from our eye real well, but we've evolved to see things a meter away well. And so that's part of an intentional design. This is a natural, comfortable place to see the media that's being provided to you.
Thank you. So as we mentioned, Innovega has multiple different revenue channels that we'll be going into strategically. The first is hardware sales, which we're now actively executing. Marco has a great question, Steve. Has there been any discussion about sharing about licensing any patents in the portfolio? Can you speak on that?
Yeah, it's sort of a second order revenue stream, maybe even a third order. We've filed 80 patents. So as a company, we're very patent rich, and certainly every opportunity exists to license them for other applications. We're going to be quite busy for the next year or two with the low vision community. And a meaningful question there from Marco is, why wouldn't you license your patents to Rockwell Collins or Lockheed Martin to do some defense work? And the answer is, we will look at all of those opportunities. There's really a product sale, an immediate product sale opportunity. We're contemplating a potential subscription app related revenue stream. And a third would be this licensing as the smart glasses industry matures. So if we have opportunities to do gaming or enterprise or defense, and we don't want to use all of the Innovega resources to attend to that, then the licensing model, licensing patents, licensing designs, is the absolute model that we would use. There's no urgency to do that in that our patents have got a lot of life, and the smart glasses industry is coming off the ground. So it's not as if we're behind. In fact, as a company, we've always been well in advance. But good question.
Thank you, Steve. Go for it.
I did see another question, and Arthur may want to respond to it. Why do we refer to a so-called Gen 1 or a Gen 2? And what Arthur's been describing, our commercial product to market, is that what we call a Gen 1. So Arthur, you might want to just pick up on the difference between a so-called Gen 1 and Gen 2.
Yeah, I think that was just us not having a particular name yet for each of these products, like a consumer-facing name. And so we were just saying Gen 1 and Gen 2. But the Gen 1 glasses are what we're talking about today, right? And that is the glasses that pair to the phone. It doesn't require anything else besides that pair of glasses and that phone. And that's what we're building. We're focusing on a lot this year to be able to come to market by the end of the year. The Gen 2 is the thing that we've been working on for a very long time, which is the contact lens plus glasses solution. And that's where there's additional optimization and additional features that can be part of that contact lens plus glasses solution that we're calling the Gen 2. And so that is something that we are still working on, but takes longer to go to market, which is why we're calling it the Gen 2.
Fantastic. What about, can these assist with computer use and up-close tasks?
Absolutely. So these are designed so that it can help people who need that acuity to gain that acuity, right? And so to be able to look at the computer, look at your phone, being able to mirror some of those devices, or just look at it through that camera that then puts it onto the display. Those are all possible. We can absolutely look at computers, TVs, phones. All of that will work.
Fantastic. I'm going to answer a quick question. Catherine was asking about the Founder Series versus a previous Gen 1 reservation. So up until this point, we've been allowing anyone to reserve one of the first pair of glasses. After next week, after this official meeting, we'll be reaching out to the reservations to transfer those over to a Founder Series pre-order. So it's just, if you made a reservation, we'll be reaching out. But if you're interested in actually pre-ordering, the Founder Series will replace, just the early reservations. So Catherine, hopefully that helps, and let me know if anything's not clear. Charles asks, can you drive with them? Steve or Arthur?
I can. Go ahead, Arthur, please. There's maybe a couple answers to that, but Arthur, jump in and I'll follow up.
Yeah, absolutely. So, these glasses are designed to still give you your peripheral vision, if you still have that. These glasses are designed so that they're transparent when the display is off. And so all of that goes to say that, and we'll be able to put prescription in there as well. And so all of that goes to say when the display is off, it acts like a normal pair of glasses, right? And so really the technology is not prohibiting you from being able to drive. The benefit of having glasses is that you can also do image enhancements on top of what you're seeing in the real world. And so maybe be able to help you gain additional acuity that you might be missing. All of that goes to say that technology does not prohibit anyone from being able to drive with these glasses and may help. On the regulatory side, on the legal side of things, I think this is where it gets a little bit more sensitive, in the sense that every state has their different regulations on what is legal for you to drive or not. And there are plenty of low vision folks who end up getting a driver's license, who the state has said, yes, you can absolutely drive with your vision aid. And oftentimes they go to a low vision specialist. They don't go to the DMV and try to do the eye chart there, but they go to their low vision specialist. And the low vision specialist gives them some aid that will help them in driving and passes off to say that, yeah, they are okay in the car and being able to drive. And that goes back to the DMV, that state's DMV to obtain that driver's license. And so we're not saying that you will be able to pass any given test, and it very much depends on your particular condition. But in all intents and purposes, these glasses should be able to help.
Right. And I was having a pretty deep dive conversation with one of our clinical ophthalmologists, and he was saying there's actually not well defined legalities around digital enhanced eyewear. It's a new thing. So it's kind of like the Wild West right now from a legal standpoint. So there'll be, I'm sure, lots of new regulations coming down to better suit the new technologies that are coming out and what's safe to use in different circumstances.
Yeah, we have on our team, Joseph, I can mention, Dr. Apita DeGraciano. He's one of 50 absolute low vision experts across North America. And it's a fact that you can visit him today with a low vision condition, and he can provide you with aids to enable you to apply for a driver's license in the state of California. We know that much. So when we're asked this question, I have two reactions. One is never say never. In other words, there's a path that Innovega is moving down, and we'll see. And the second is we know how important it is, and I'm reminded by every low vision patient, by losing their ability to jump in a car, they don't go meet friends at the coffee shop. They don't take a run to Walmart to pick up a prescription. They're waiting very frequently. And that touches us. And so we realize that if one could enable someone that level of independence to drive, even within a well-defined environment, it would change a great deal for that individual. So we take the request very seriously. It's aggressive. On the other hand, that's sort of what we do.
We're going to keep going for a little bit, but I know I just want to be time conscious of everyone. So in the
Yep.
chat, I just shared some links. One, obviously, we're still raising funds to help fuel all of this growth. So our investment campaign link is right in there. Please check it out if you haven't already. The Founder Series pre-order page is in there. The video with a bit of a narration for how they work that we shared earlier is in there. And then once again, if you don't have a chance to get to your questions, you can book a follow-up call with Corinne. I suggest you open that link up before the meeting ends so you have access to her.
Joseph,
Yep.
for others to be able to jump in and get copies of those links, and it may be difficult, may take a little time for certain folks on the call. How do we enable that? Do we leave the link live for 5 or 10 minutes after we're finished here? Okay.
Yeah, we can leave this live and leave it in the chat. And then afterwards, we'll be sending out a replay of this webinar and we will reattach those links. So most people on here should get that email. So there'll be multiple ways, but just depending on how quickly
Fantastic.
people would like to move. So one question I'm going to answer really quickly. What if you only need reading glasses? We're not really designing these for people who reading glasses are sufficient. Our technology is mostly to serve those with moderate to severe visual impairments where there are no good solutions currently.
Joseph, a variant on that I saw coming in was, what if I already have prescription glasses? No, I use prescription glasses. They help me. How does that work with your glasses? And Arthur, can you broach that?
Sure. So a lot of people with low vision who have retinal issues, they also have a lens issue, right, where they are nearsighted or farsighted. We'll be able to accommodate that by having a frame that you can put your prescription into, and that just clips onto the back of the eyewear. It is just a frame only because we don't need or want to have all of your prescriptions. And the general way to do that is you get shipped these glasses with that frame, and you take the frame, just like any other glasses frames, to your optometrist. They put in your prescription, your lens, and then that just fits right back into the glasses.
Thank you, Arthur. Okay, we're going to keep moving quickly through these questions. Does this get affected by LASIK?
No. As in, if you've had any vision correction, you can still use our glasses as if you have really good eyesight now that you've gotten LASIK.
Thank you. Will these glasses auto-tune based on the actual condition of each eye, or are you required to preset them to the condition of your eyes?
So as we've been learning about, the low vision community, everybody has a different kind of condition, right? Even if it is the same um, category, everybody's symptoms are a bit different. And so I think everybody's level of aid is going to be different. We're going to be able to have the ability to customize how you want to be able to use that display, how much magnification, contrast, brightness, if you have any brightness sensitivity, color enhancements, all these different knobs will be there. And we'll be able to customize it based off of the use case as well, right? It might be different for you to be able to read versus be able to walk around versus watch a TV versus having a conversation. And we want to be able to have those different settings be adjustable. And the goal is really to be auto adjustable so that in any situation, your preferred settings get set up for you in that task that you're doing. In terms of actually accommodating to your exact condition and where you're actually missing information or where you have low acuity, I think that's part of a learning phase with the device and what kind of settings are the best for you.
Hey, Arthur, I could add that conditions may change over time. A person may have surgery, their eyesight might improve in certain ways, but not other ways. And so our ability to provide that digital prescription, that customization is fundamental to what we're offering. And I can also maybe add that Joseph described, we're tethering to a phone. That phone will run an app, and we'll be able to adjust these various parameters, perhaps on the glasses, but certainly on the phone itself. So it'll be like operating an app. You dial in what it is you need, and then it becomes an app that's running your prescription through the glasses. So I think that'd be very helpful for everyone. Hey, Joseph, you've got 77 messages in the chat. You better get going. We've
We're
got
doing
3
pretty
minutes
good.
left.
We've only got a couple, only got a couple left. Okay, next question. Can you talk about how or if the glasses accommodate for light sensitivity, meaning you can control or dim the brightness of the screens?
Oh yeah, the display will go brighter or less bright as the needs are. It will auto adjust based off of your environment, right? So if you're stepping from a dimly lit room to something that's brightly lit, it will automatically adjust for that brightness. But you also have full control over that. And if you have brightness sensitivity, that we can absolutely adjust the display brightness for you. The other aspect of it is being able to walk outdoors and be in sunlight. And we have the ability to tint the front of the display as well. We're working on multiple solutions to be able to do that. But the ability to turn your glasses into sunglasses when you're outdoors and still, both be able to have that kind of lower light accommodation, but also being able to see the display is very important.
Would depth perception issues be a good fit for these glasses?
I think we'd have to figure out what depth perception issues are in that particular case. What we are presenting to the user is basically a screen in front of them, right? A floating screen that's about 1.5 meters away. And so there really isn't a need to have any depth as part of your vision to be able to use the glasses. So if you have trouble with depth, it's still okay. You can still see the screen, the virtual screen that's in front of you. But I think it's really an understanding of what issues that person is having trouble with.
Okay, couple more questions, and then we'll try to wrap it up in the next few minutes. Can someone with a detached retina and loss of vision use this?
Depends again, I think, on that on the symptoms. So I think a lot of times folks will go to their optometrist or a low vision specialist to get a diagnosis and figure out, what the actual symptoms and conditions are, and then we can address whether these glasses will help them or not. If our glasses are there to help people with central vision loss. Oftentimes, retinal detachments could be in your macula in that center part of your eye, or it could be somewhere else in your eye. And right, we don't really know about that. And so we can help a lot of those cases, but not every case.
A test we often get suggested from our low vision optometrist is if a person can use a magnifying glass or if they can use an iPad with a 5 times zoom and that offers them benefit, then our form factor paranormal glasses is going to should assist them significantly. So a person who's got retinal issues to include a detached retina, the answer is Arthur said, it depends. Everyone's vision system is different. But if that individual can use a magnifying glass or zooming on a digital device, there's opportunity for us to assist them. And the devil's in the details.
Thank you, Steve. Okay, we'll do two more questions. One is just kind of a general use case. I have a tiny telescope in one eye. Will it work for never? We have a Tesla self-driving car. Will I be able to drive that? I play golf 4 times a week. Will it help me see my ball? Um, Feel free to dive.
Lightning round of questions, I guess.
Yes.
That was all one
Is that one
person. So
question?
help
Oh,
them
okay.
understand how this can fit into their life or not, essentially.
So compared to a telescope, right? And what I'm hearing here is that the telescope is like a regular pair of glasses with like a microscope objective almost that's mounted on it. Absolutely, these glasses can replace that. And so it replaces it in the sense that it gives you that magnification if you need it. But it also works better than that in the sense that it looks like a normal pair of glasses. It's not unbalanced on your eye, and it gives you a much bigger field of view. So it's like having that magnifier, that telescope, but much bigger, and still look like normal glasses. So in that sense, yes, it will help replace your telescope. If that telescope helps you find the ball when you're golfing, these glasses should be able to do the exact same thing. Um, in terms of driving with full self-driving, if Tesla gets to a point where full self-driving really is, hands off the steering wheel and you don't need to monitor it, then anyone can, be in that situation, right? You could be completely blind and still be in that situation. But I think it goes back to the can I drive with this pair of glasses? And that really depends on kind of the laws of your state and whether you can legally get a driver's license.
One
Thank
thing
you,
I'll
Arthur.
say, go ahead.
Go for it,
No, I was
Steve.
going to the telescopes is what we have today is state of the art. I think the person asking the question may have these modified glasses with a prism, a lens called a telescope, and that enables them to do a certain thing. But we know an individual who's got a pair of glasses for reading of that type, another pair of glasses for watching television 6 feet away, and then another pair of glasses for looking off into the distance. And that's 3 pairs of glasses and an $8,000 investment. We'd replace that with our glasses that are adjustable. And so with a common pair of glasses that are fit for you, personalized for you, we fully anticipate and have tested an ability to read, very near to watch a TV at 6 feet or look across the street at 100 feet. And that is just part of the value add of our eyewear. And others will still buy the glasses, the telescopes that the person is asking about, but ours offers a completely different, a completely new level of performance and flexibility.
Thank you, Steve. So
Yeah,
I lied. I said we have one more question left, but really quickly, Alex asked, is there any use case for patients diagnosed with NAION, Naion? Apologies if I said that incorrectly.
I, I,
I
I
think we'll
couldn't.
need to go and look into that a little bit more.
Yes.
Okay, no
I,
worries. Go for it, Steve.
I was going to say, neither myself nor Arthur are clinicians. We're not optometrists or ophthalmologists, so we wouldn't have that answer. But we're willing to explore these things. The level of interest of what we're doing is obviously extremely high. We only have so many hours in a day. That being said, the more focused you can come to us with a question, a great opportunity for us to answer.
Thank you. Okay, last question of today's webinar, and we will be having another webinar in a couple weeks, so stay tuned. Michael asks, what kind of margins would Innovega make on sales?
Yeah, I can give an answer as traditional margins. In other words, we're designing this to be a product that can satisfy the needs of shareholders that have been very loyal with us and are looking for a substantial return on investment. So there are not-for-profit companies that can proceed and do good for humanity, and that's a big part of who we are, what we do. But a second piece that we never forget is that we've got thousands of shareholders who joined us in part because they're getting on the early, the front edge of technology, and they deserve to be rewarded well. In order to do that, we need to deliver traditional margins.
Thank you, Steve. So
Yeah.
with that, I'm not sure if there's an issue with the chat today. A lot of people are saying they can't see the links, even though they're continually in the chat. Charles, you'd asked about you were approved to be a test pilot. Please, if you're confused about the application of your demo request, just send us an email to social@innovega.io, and we'll be sure to follow up with your application. Bill, you're also asking about the best way to learn more. So I have put in the chat one more time all of the major links we talked about today, including the investment campaign page, which is the best way for you to learn more about potentially reinvesting. And thank you so much for your support. Arthur, appreciate you being here. Steve, it's great to see you as always. And everyone, appreciate the growing community, amazing support. You're the only reason that we made the progress we've made today. It's exciting times, probably the most exciting in the history of the company. And we look forward to keeping you informed as we take the next big steps forward. So we'll see you at the next one. And I will leave this meeting open so anyone can access the links in the chat for the next 5 minutes or so. Thank you so much.
Thanks to everyone.
Thank you all.